Hello, everyone. My name is Haley Bell, and today I'm going to be talking about emergency medical dispatching with CLAS, or culturally and linguistically appropriate services. During this session, I'm going to be talking about cultural humility, why it's important in EMD, and how practicing it can benefit EMD for dispatchers and patients. After this session, you should be able to define cultural humility and its importance in emergency medical dispatching, recognize assumptions and biases that can be barriers to culturally and linguistically appropriate services, and ensure equitable services for all callers by applying cultural humility. So first, we're going to talk about what cultural humility is. The official definition, according to the Office of Minority Health, is a reflective process of understanding one's privileges, managing power imbalances, and maintaining a stance that is open to others in relation to aspects of their cultural identity that are most important to them. This can be achieved through self-reflection, openness, a recognition of knowledge gaps, and learning and growth. Now we're going to move into talking about cultural humility as it pertains to emergency medical dispatching in particular. As dispatchers and call takers, we are going to constantly experience cross-cultural communication. The population of callers is very diverse and often in a state of distress, adding another barrier to communication. There is a high risk of misunderstandings when clarity is important to the outcome of the caller's emergency. Assumptions and biases, both unconscious and otherwise, can have a profound effect on the quality of care received. Practicing cultural humility for these callers and patients allows us to build trust through effective and empathetic communication, which leads to equitable services, positive outcomes, and caller satisfaction. Now let's talk about some examples of cultural humility in dispatching. When receiving a call from a person whose first language is not English, even if they are still attempting to communicate in English, the language line should be utilized to provide an interpreter. While this can feel cumbersome and time-consuming for the call taker, it fosters a supportive, comforting, and effective communication environment for the caller who is already likely experiencing a stressful event. A caller who is a native speaker of Spanish, attempting to communicate with the dispatcher in English, is asked by the dispatcher, "Is the patient breathing?" The caller misinterprets this as, "Is the patient bleeding?" and answers yes, due to a small cut on the patient's arm. The call is then coded as a routine response, and the patient outcome is negatively impacted as they were not breathing. Even though it may seem as though the caller should have provided critical information without being asked, it is important to remember that health literacy varies, and the caller may not understand what constitutes an emergency situation to an EMD. EMDs will encounter many different callers from all walks of life. They will often experience callers who are experiencing homelessness, substance abuse disorders, and psychiatric illnesses. Each EMD should be encouraged to reflect on any existing assumptions or biases they carry so that each caller receives equitable services. A patient with a history of mental illness calls the dispatch center often for complaints of paranoia and hallucinations. This patient usually denies transport after the ambulance arrives. All of the EMDs are aware of this person and tend not to take their complaints seriously. One day, this patient calls with complaints of impending doom, hallucinations, and shortness of breath. The call taker decides to downgrade the call, despite protocol, based on their assumption that this call will have the same result as every other one before it. The patient stresses to the call taker that something is wrong, but the call taker does not change their decision or investigate further, giving an extended ETA and ending the call. When the ambulance arrives, the patient is in cardiac arrest. If the call taker would have set aside their assumptions about this patient and treated them with respect as an authority on their own health, the patient could have received an equitable emergency response and a positive health outcome. Thank you for listening. I hope you take this knowledge and look for ways to incorporate cultural humility into your work at an emergency medical dispatch center.